Welcome and thanks for joining us for this discussion on open disclosure. I'm Shannon Harbinson, a Senior Manager at InSync, and today's session is part of our ongoing collaboration between AIHE and InSync, aimed at driving meaningful change in healthcare. I have Dr. Sydney Chandrasiri and Dr. Lewis Prado from AIHE with me today to explore some key challenges and opportunities in open disclosure. To get us started, I'd like to paint a picture for you on why open disclosure matters. InSync has looked at data from the past 3 years from over 50 studies and 77,000 patients. And out of those 77,000 patients, 6% of them have reported that they experienced unexpected harm. And of those patients that experienced harm, 50% of them said that they either did not have a conversation about their harm or that they were not sure that a conversation took place. So, Dr. Chandrasiri and Dr. Prado, why is open disclosure a conversation that we cannot afford to avoid?
Well, thank you, Shannon. Thank you for the invitation. It's great to be here. Open disclosure in itself by name is a problem because it separates out what should be ongoing patient care, and if something happens, that patient-centric care should ensure that we are able to communicate with patients about what happened, why it happened, apologise for it where it's appropriate, and ensure that we do our best to prevent it happening again. Separating it out from the usual care of a patient and instituting a new process invariably means that often it doesn't happen or it doesn't happen properly. Embedding open disclosure as part of usual care when something does go wrong is really essential for the patient and also for the clinicians.
Thank you, Lewis. And I absolutely agree. And for me, I think it comes down back to the purpose of healthcare leaders, really, and their role in healthcare service delivery. Healthcare is an area that requires patients to trust the clinicians and trust the healthcare leaders that provide that service. So for me, it's all about the accountability and the transparency and responsibility that we have as senior healthcare leaders to be open and upfront in terms of care at all times, especially when it goes wrong. And the other aspect of it also is that it actually helps to identify the issues so that we can do whatever we need to do to try to minimize it from happening again.
Thank you, Dr. Chandrasiri and Dr. Prado, for your insights and your perspectives. It's clear that this is something we need to keep talking about. We appreciate you being part of this conversation, and we'll see you in the next segment.